Yeah, so I think this is really fundamentally probably the most critical question for our field from a therapeutic standpoint right now. So when we think about when and how to intervene therapeutically for patients with MPNs, we can look at it, and if you're from, sort of both sides of the coin, so to speak. So we might say, well, where the real unmet need is for those patients with very advanced disease, for instance, even at the cusp or at the time of progression to secondary AML, and that's the most sort of adverse stage of the disease. There's no question about that. If we could effectively treat patients at that stage, that would be of extremely high value, and that is for sure a focus of work from my group and others. Of course, that's challenging when the disease is already at such an advanced stage in terms of really being able to achieve a true benefit from a therapeutic standpoint. We can go to the other end of the spectrum and say, well, maybe we should be focused on intervening as early as possible to prevent those more advanced stages from ever happening. And I think there's a strong justification for that as well. We really have to look at that a little differently in terms of thinking about long-term outcome, long-term benefit, as well as safety and tolerability for treatment for which patients may be on for an extended period of time. So I think, again, I would say both, ends of the spectrum remain very high priorities of focus for the field to really advance new and better therapies.